In this presentation, we would like to share with you two different approaches on the impacts of energy poverty and children in the city of Barcelona. And this has been done by Laura Oliveiras Puig, PhD candidate, the Health Public Agency in Barcelona, and Irene González Pijuan, PhD candidate at Sheffield Hallam University. Several authors have studied the impacts of energy poverty on children. We have proposed these four dimensions: physical health dimension, taking into account the prevalence of some illnesses as asthma or bronchitis and the nutrition problems that have been reported. Also, education problems have been reported, like difficulties for home studying or not going to school due to illnesses and other things caused by the energy poverty situation. Also, and not always considered, mental health issues are very relevant in terms of stigma, guilt feelings, and social relations. And finally, the security issues due to irregular connections are also very relevant and not always taken into account. Given those documented impacts, a report has been done by Engineers Without Borders in the city of Barcelona, trying to deepen this analysis of the consequences of energy precarity on children, but also aiming to propose specific public measures and willing to collect and strengthen the voice of households in an energy precarity situation. So that's why the data, the conclusions that you can read in the report come from the review of the existing evidence and data, but also come from interviews with affected families, with families in energy poverty that are members of the Alliance Against Energy Poverty, also by the interviews done with professionals working with children, and also from workshops at school and from information that has been shared in those collective assemblies by the Alliance Against Energy Poverty. According to the indicators published by the City of Barcelona, the report found very high geographic inequalities in energy poverty distribution in children. If we take a look at the two main indicators in this slide, we can see people age 0-17 living in inadequate temperatures and people age 0-17 living in homes with arrears on utility bills. And there are very high differences between the most vulnerable neighborhoods in the city, where we can find almost 1 in 3 children living in inadequate temperatures, and also 28.7% of children living in homes with arrears on utility bills, which is a very high percentage. Also, the security dimension is a very important aspect of energy precarity among children and young people. A survey has been done among families with regular connections in the Alliance Against Energy Poverty. More than 60% of the families were willing to have a regular connections, to pay for their electricity actually, and to have like secure connections. However, there is a strongly criminalizing discourse towards these families, and there's a difficulty to understand that energy needs involved in the tasks of care and support of life are especially necessary during childhood. So families always seek ways to provide energy services, even if they are unsafe. We've seen this in the terrible case of La Cañada Real, which is the biggest settlement, a huge settlement, irregular settlement in Madrid. And from October 2020, there are no basic supplies there. There has been a cut of basic supplies. And since then, there has been, for example, a lot of intoxications by monoxide of carbon because families look for alternatives to provide their children, to provide their homes with energy services. And in this case, it's like to fight those criminalizing discourses towards like these vulnerable neighborhoods. A group of children out of the 1,800 that are living there, a group of them have been actively denouncing their situation to United Nations and have been actively reporting the consequences, the impacts on health, mental health, on education and physical health that is having this situation of living without basic supplies on them.
Now, we would like to share some key insights from the study entitled The Association of Energy Poverty and Health and Well-Being in Children in a Mediterranean City. The aim of the study was to provide an in-depth description of the distribution of energy poverty by sociodemographic, socioeconomic, and housing characteristics, as well as to analyze the association between energy poverty and health and well-being in children in Barcelona in 2016. For this, we conducted a cross-sectional study using data from the Barcelona Health Survey for 2016. This survey has a specific questionnaire for children under the age of 15 years, and the sample size is 481 children. The study included many variables, but just to name a few examples, as health and well-being variables, we include general health, mental health, health-related quality of life, asthma, and overweight. The main energy poverty variable used in the study was a self-reported indicator, including households that could not afford to maintain their dwelling at an adequate temperature during the cold and/or warm month. As sociodemographic variables, for example, we include sex, age, parents' country of birth, and household composition. And as socioeconomic variables, for example, social class or having arrears on utility bills. And as housing conditions, having no means of heating or no air conditioner, for example. Regarding the analysis, what we did, first we calculate percentages of energy poverty by sociodemographic, socioeconomic, and housing variables, and also prevalence of health outcomes in children with and without energy poverty. And lastly, we calculate the prevalence difference and ratios of health outcomes among children with and without energy poverty. This first graph shows the percentages of energy poverty by different groups. In red, you can see the mean percentage of energy poverty in the city of Barcelona, which is 10.6%. We observe large inequalities in the different subgroups, experiencing, for example, children with parents born in low and middle income countries and single-parent households higher energy poverty percentages. The highest percentages of energy poverty are found in families who also have food insecurity, arrears on utility bills, or no means of heating. In this second graph, you can see the prevalence of the different health outcomes in children with energy poverty in green and without energy poverty in gray. Overall, children in energy poverty have poorer health outcomes. For example, children living in energy poverty have 7.7 times more poor general health and 2.46 times more poor mental health. We also observe higher prevalence of asthma and overweight in children with energy poverty, 4.19 and 1.50 times more than children without energy poverty, respectively. As final thoughts, we would like to highlight that the number of children living in energy poverty in Barcelona is high and that there are large inequalities by territory and by sociodemographic, socioeconomic, and housing conditions. Also, that although energy poverty has severe specific effects on children's well-being, there are still many knowledge gaps, such as about the lived experience of children living in energy poverty, or about how to develop meaningful policy and practice to address energy poverty in children. Finally, we would like to point out that it is to be expected that the social and economic situation generated by the COVID-19 pandemic will drag many families into energy poverty, as we have already seen with the 2008 economic crisis. And that's all. Thank you very much.